Hamilton Community Foundation's new Vital Signs report says the rate of COVID-19 cases in 20% of Hamilton's neighborhoods with low-income and racialized residents was almost double the amount of cases in 20% of neighborhoods with the wealthiest and least racialized residents.
Exposure to infections are dramatically greater in racialized and indigenous communities. They tend to be concentrated in lower income neighborhoods where people are doing the heavy lifting of working in meat packing plants and driving buses.
But the report also says these inequities were already there before and the pandemic made it worse. Professor Emil Joseph says he wasn't surprised.
People also sounded the alarm early in the pandemic that we were going to see an exacerbation or magnification of these inequities.
Kojo Damti from the Hamilton Center for Civic Inclusion was one of those people sounding the alarm, and he's frustrated.
We try to talk to public health and municipal governments, provincial governments, federal governments to say, hey, this is what's going to happen. And so we are now a year and a half or so through this pandemic, and little action has been taken.
Both Damti and Joseph say one of the issues that need to be addressed is restructuring the Board of Health.
When you have a Board of Health that's full of elected officials that do not have lived experience or health experience, it limits the discussion.
I think, we have leadership that don't understand that, and it comes out in some of these inadequate responses to these needs.
And the outbreaks in 3 of Hamilton's apartment buildings is an example.
Those apartment buildings, we know racialized, Black and low income residents were there. And yet we didn't provide them with on-site vaccinations, right?
Health equity advocate Lyndon George also says this is a call for action.
Our measures need to be a reaction to the data. And if we do that, our response would have been different. And we wouldn't be right now having the outbreaks in the same situation at Rebecca or at Wellington.